I would not wish to take this opportunity to say anything else about what has happened in the past. But my conclusion for the last 3 days is that whatever we planned for all those months, based on the instructions from you, because whatever we are doing is based on the instructions that were given by the alumni that we must celebrate this 50-year milestone. I think we have done a commendable job in terms of planning, and delivery of the assignment that were given by the alumni members. Have we? Okay. And I think we are not yet through the process. There are quite a number of other activities that are in the pipeline. And we have a very effective committee chaired by Dr. Moses Mangi, the Planning and Logistics Committee. And this committee will ensure that all the other planned activities will be implemented as per the plan that we have set out. This flyer that you see here is a summary of what we have actually planned for the celebration activities. There are quite a number, very ambitious, but I think we are chewing little by little and delivering little by little. And by August, I'm sure we shall have gone through all those activities, and we shall have a very rich report to give to the alumni members when we meet next. We are planning to have the AGM for the alumni on 28th, even the date has been set, on 28th of August this year. We are reviewing the Constitution. We are going to expand on the management, because we need to we need to reflect on the management that we have in our own Constitution vis-a-vis the management that is being proposed or has been proposed by the University Alumni Association, which we are a chapter, so that we are able to have some kind of alignment. So the positions that we shall offer during the AGM are broader than what is covered in our current Constitution. I am appealing to you, the young people, to come forward and vie for the various positions for the Alumni Association. We are going to declare all positions vacant, including mine, as a chair. All positions will be declared vacant. I have been there for long, and I'll be very, very happy to step aside and give an opportunity to a younger person to lead the association. And I'll be within, I'll be mentoring from within. So even if I'm not there, I'll still be giving, a helping hand to whoever comes in. So count on my support. I'll not step aside, okay? So based on that, please don't be afraid to vie for the chairmanship, the vice chairmanship, the treasurer, the secretary, whoever, okay? So the floor will be open. And that is why we have a very active membership recruitment, because for the AGM, you must be a paid-up member to participate in the AGM, okay? So make sure that you pay your membership fee and come forward and be counted, because the association is as strong as its members. The association is as strong as the leaders that is disabled to bring on board, okay? And I think with that, I can only congratulate ourselves, not me alone. Oh, no, we are not closing. I know he is coming in. With that, let me just congratulate you for what you've done, even the patience that you have had to stay around for the 3 days, and engage with the facilitators and the speakers, and just be part of the team. I was telling one of my colleagues that those of us that are joining online, they are part of us, as listeners, but they should also realize that there is something that they have missed out by not being here. That is that aspect of physical interaction, with your colleagues, networking, which makes the participation richer, than just listening to the presentations. So next time we have an engagement like this one, I'm just inviting our online listeners to make sure that they come physically and we network and interact with you. Macho kwa macho, mnasikia? Okay? Mondo kwa mondo, tuangaliane kwa macho, si ndio? Okay? And rub shoulders and feel good about each other, There are colleagues that are here that I haven't seen for the last 40 years, 40 years. And can you imagine the joy I feel when I embrace them, I shake hands with them, I hug them. I mean, it's something that uplifts my spirits. Okay. So thank you very much for those few comments, I believe. And we shall allow, I think, Professor Kigen, you can come on board and say something. Yes, welcome him and let him tell us what he is about.
Can we appreciate Prof? Truly inspiring, indefatigable, and able to lead the young, the middle-aged, and the old. Let's appreciate her again. You've been sitting for very long. Would you like to start up? Yes. As Professor Kigen, organize yourself. Yes. Sasa, can we lift up like that? We can box in front, side. If you can bed. Thank you very much. Would you be seated? Patrick, may I request you put that we made a mistake in the leadership. You may have a seat. If a leader realizes they made a mistake, is it okay to apologize? It is okay to apologize. Yeah, when we put in that, the account missed 10-80001, and some people have suffered who are trying to pay. So I wanted to correct for those of you who are still online, the account number. I'm sorry, we made a mistake. The one you see now is the correct one. Some of you have already been corrected through, you sent a message to our contact and it's corrected. Some people have already ordered and the delivery is being done. Can we appreciate that? So we still have this merchandise available. Please order and it will be delivered. And for those who are here physically, if you go home without a mug or a t-shirt with as a souvenir, why are you there? If you go to the palace and you do not see the king, can you really say you are in the palace? When you go to palace, you must see the king. Then you say you're in the palace. You must carry something to remember. And let me take this opportunity now to invite my classmate, class of 1987, Professor Gabriel Kigen, who is a professor in the School of Medicine, Moi University. You'll tell us better. Give him a clap. He's going to help us look into the next 50 years. 50 years. Those of you who will be there when we shall be celebrating centenary, I pray that you'll be there so that we can ask him, had you seen this? Welcome, Kigen.
Thank you very much, classmates. This machine died. It has just resuscitated. I was going to charge again. But let me just have the presentation because this one can die any minute. The power is off and I've been charging. So I know everybody is fatigued, tired, but it's been a great honor to be here and meet colleagues, and more importantly, above all, meet a lot of pharmacists. It's not all the time that pharmacists meet together. I hope we can improve on that. And the alumni is taking us the correct way. I know we have the annual meeting, but that one is usually combined with a lot of issues. There's holiday, there's a lot of stuff. But this time we were here for business. So thank you very much, my classmate. Thank you very much, my teacher, who has refused, I think I'm now older than her. I can't even bear. Anyway, so this one has gone. Well, I am just relying on the other one. This one is on and off. It's a teacher's, so this one you use it. If it gets lost, it's not usually the best. So I think I would have wanted, I wish we had time, but now obviously we don't have much time. I would have wanted this to be more interactive for 2 or 3 reasons. This is a very, very difficult thing to do, and we need the contribution of everybody. We obviously, when you are the last, usually it's very difficult because everything has been said. So everything you do, you will be repeating somebody else's, and it's a bit embarrassing sometimes. But anyway, I'm gonna try to see. I had made a presentation when Moses invited me, and having seen what was going on yesterday, I decided I want to change it. But then I said I will not change it. So I will just use my initial presentation, although it has a lot of duplication. Or what is there an issue? This session is a combination of a lot of things. It is a combination of all what we have said here. And let me start by saying which was actually going to be my first slide. As my classmate has said, we graduated in 1987. And when we graduated, 2 things happened. First of all, there were too many opportunities. Yeah, so there you go. So let's use this. So that's my name. I'm a very proud pharmacist from University of Nairobi. And I now teach in a medical school, but now we are also starting a pharmacy school. We started with a master's program, but we'll talk about that later. So it's gone again. This is the problem of being the last. After everything has failed. When we were in Chiromo, there was something very interesting. That big chemistry lab, and we used to do exams there. There was something, I don't know if you remember, you read it. It read that read the instructions after everything has failed. So, now that so maybe we can read the instructions because that thing seems to be working. Okay. So now that my gadget is not working, so let's use this. So let's go to the next slide, please. Now, I intentionally used 1987 because as Moses said, that's when we graduated. I am not sure about this, and please forgive me. I've put some rudimentary figures. When we graduated in 1987, we had 100% to join the government. In fact, like I said yesterday, we were struggling how to get out of the government because we were bonded. We had a community pharmacy, all of us. I will talk about that shortly. We had veterinary pharmacy, all of us. I remember he was ahead of us. He opened a big retail outlet in town. Yes. Was it Murungaru? Okay. Then we had marketing. That's where we all wanted to go because there was money. Then there was manufacturing. We didn't like it very much, but we had the opportunities. There was research, academia, supply chain. We ran it in hospitals. I guess this is probably what is going on in 2025. I'm not sure about the percentage, but clearly what it means, we have lost some areas and our opportunities have diminished in some areas, purely because we have been either replaced or we have had competition or we have brought in visitors. Unajua ukilete visitor kwa nyumba, kidogo atasema ni yake. And I heard somebody say we now control 4% of retail, which is a bit of a shame. Now let's go to the next, and I put it here intentionally that we hope to get solutions from this. And then, because people have said, if you want to know the future, look at the history, then perhaps it can guide you on the future. Now let's go to the next slide. Now, as I always have told many of you, I lived in UK. I studied, and just before that, please. Yeah, I studied in UK and I lived in UK for quite a while, more than 5 years. And what British always say is, what lessons have we learned? Whether in failure, I've had a very good lessons on failure today and on leadership and failure. So whether in failure or in success, the British will always say, what lessons have we learned? If they succeeded, they will want to know the lessons to make it better. If they failed, they will look at the experience to now see how to win the next time. And it always works. And I think my colleague has mentioned that at some point. So let's go to the next slide. So how did we get there? I'm more interested in the opportunities that we have lost. So as a teacher, sometimes it's good to pose some questions. So how many opportunities that were reserved for pharmacists, Moses and I, when we graduated? So first of all, the first thing is replacement by other cadres. Somebody talked about the retail, retail community pharmacy. I was shocked. I thought we were in 40%. Somebody mentioned 4%. I hope that's not true. Because we have gone from 100% to 4%. But we need to come back. Relevance, recognition. This is not so bad. How relevant is our profession today in the Kenyan settings and at that time? I think on that we have improved. How can the image be improved? So those ones will guide us for the next 50 years, maybe. The reason why I'm saying that, and I forgot to put it in, all professions are under threat from one very dangerous animal called AI. AI is going to eliminate everybody and all professions. So we know people will be ordering drugs. We've seen like videos of even supply chain within hospitals with robots and everything. So we have to be prepared for that going forward. Protection of professional interests by pharmacists. Are Kenyan pharmacists protecting their profession? Tafadhali musinipige mawe. Our age, we really messed on that a bit. Because especially on retail settings, maybe we were not very careful. We invited people, maybe as partners, maybe the people we worked for You want to have a certain cadre run your business and some place, and you're playing golf, and you want to make a call, how much have we made today? Within time, that cadre actually ran the place. So you took off. So how do we do that? How do we protect going forward? And then are there opportunities to protect through not really legislation, but maybe regulation? Because the pharmacy profession can only, it is one profession that really survives on regulation. Without regulation, you'll have a lot of problems with the pharmacy profession. Why? Because it is a good profession. Unajua, we said that replacement by other cadres. Why does everybody want to be a pharmacist? Therefore, it's a good profession, isn't it? And therefore, you have to protect your profession, isn't it? Otherwise, everybody will be a pharmacist. If some cadre say, because you are dealing with this kind of drugs, we want to have, quote unquote, something pharmacy. Others who are treating will now say, we want to have, because we are using drugs to treat, we also want to have medical pharmacy. Others will say, so where will the profession be? So it really has to be protected. Are we collaborating and cooperating enough? And I think as pharmacists, we really need to look at that. Like I said, I teach in a medical school and I work with our colleagues, the doctors, all the time. I think there is more cooperation, maybe because of the way of training, where you have referral and you really have to collaborate. But maybe we were trained that you have to work alone. I'm not sure. But whatever the case is, we really have to learn to collaborate. And I was very happy yesterday when I heard the chairman talk of group practice. For the first time, that is the direction to go. I feel that that's a good way. Now, in terms of training, how relevant is our current training to the market requirements? Now, there are two things. When you look at all these, we have been trained and we were given very, very good foundation. That's why we are excelling all over in the world. But should we really improve on our training to meet the current requirements? I feel like that's where we need to focus on. We have talked of biotech, that's very important. When we were taught about design of drugs, we were talking of structural activity relationship from small molecules and improving from cephalosporins, first generation, second generation, etc. But now we are talking of monoclonal antibodies. We are talking of immuno. So are we really prepared for that? Are we training for that? Are we training our people to be manufacturers? I was very happy yesterday when I learned somebody ventured into cosmetics. By the way, cosmetics is a huge market. And I think somebody sold, I'm not sure if he was a pharmacist. I was told he was not, or a French company. How many times do you have an African company selling the technology to a French company? Is it L'Oreal or something? For $2 billion after taxation, that's a lot of money. So again, when you're in Europe in summer, you have this caravan where you drive all along Europe. It's a small place. Sometimes we drove through South France. So apart from rapeseed, which was very yellow, where they get oil to mix with diesel, I saw a huge plantation. I don't know, I have forgotten my pharmacognosy. I think it's chrysanthemum or something. This guy would know. In our community, we call it Nyosore. Nyosore is bangi because it looks like bangi. So what is it? What is it called in pharmacognosy? Because it's a weed. We plant a lot of wheat and then you have to get rid. So there was a huge plantation. I asked somebody, what the hell is this? In our place, this should be bad. Then I was told that this is used to produce the most expensive perfumes in the world. Now I've learned that. How many pharmacists will do that? We have been trained, you can manufacture. But anyway, we'll talk about that. Now, advocacy. Are we doing enough advocacy? When we talk about other cadres invading our profession, you think it's a joke. We are okay. Our colleagues, like the medical colleagues, it's war. You know, when the pharmacy said, we will register the diploma people in chapter 245, one was very annoyed. I said we should not have done that. Our medical colleagues, they allowed CEOs to register under another act. Now, they want to take over. They are practicing, the nurses are practicing, so we are not alone. I think the advantage that we have is that our profession is versatile. So you can do a lot of things. Right now, even our graduates are having a lot of problems. All through. So it's not only our pharmacy graduates. You read in the papers what goes on. Now, let's go to, the next slide, please. This one has recovered. So how do we guard these gains? Because for the next 50 years, we should be able to guard the gains that we have had since we started the last 50 years. We need to guard those gains that we had and what we had. And then, so how do we protect them? And we'll discuss that shortly. I hope I'm not taking a lot of time, sorry. So we need to, I think this is mixed up. We need to maintain the current, what we have legally, what are we required, what is within the space of chapter 244, etc. That a pharmacist is, legally allowed to do. And then we need to improve on our training, relevance. I think we're doing a lot, especially in clinical areas, but we're not doing well at all in manufacturing and other sectors. I don't think we're doing, and as Moses said in the morning, we're not doing well at all. And then regulation, I think we discussed that. And then what I've heard, and I'm so impressed, especially by the young pharmacists, is to explore new horizons. What should we do? What should we add? And I was very impressed by what's his name? The vaccinology, especially during vaccinating during COVID. That's a new horizon. By the way, there is, I think it's online. There was a survey that was done to ask the patients, whom do you trust most? And guess who they trust most? The pharmacist. So every patient would trust the pharmacist most. Now, so we need to leverage on that. Next slide, please. So now let's go to the way forward. This is just generic, just go back. Adapting new changes to needs and technologies on patient care and business growth, embracing new technologies, expanding services, we'll come to that, explore new horizons, address emerging challenges. I guess that was one of the titles you gave me. And then on regulation and legislation to protect the profession. Let's go to the next slide, please, and look at the details that we had. So if we start with the first one, the innovation and then expansion of the scope of practice, I will look at all sectors, especially the community pharmacy or retail pharmacy, academia, manufacturing. We look at all of them and see where we are bringing. So we've talked about patient-centric care, that we should have now more focus on comprehensive patient care, medication counseling, adherence, health screens, vaccination, and we are doing well on that. That's the direction to go. Which will, I don't think the robots will be vaccinating patients. I think they will require. So the clinical services, like in hospitals, greater involvement by pharmacists in clinical decision making, disease management, collaboration with other health professionals. Like we said, we started that in Eldoret, and all the pharmacists can actually do that, especially the background that we had been given. But we'll discuss that later shortly, because I think, in my view, especially the young people, they don't want to be in school. That's the experience in Europe. They don't want to be in school for a long time. So how do we cure that? We'll discuss that shortly. That they should be enabled to practice maybe clinically or manufacture or whatever as soon as possible without spending too much time in school. That's the direction that is going on in Europe. Point of care testing within the retail outlets or community outlets. There are a lot of somebody talked of influenza vaccination. We can do testing as well. That's not a big issue. We can also have like anticoagulation clinics, patients, people old like me, maybe they are on warfarin or whatever, they would require that monitoring, simple INR. We have like in Eldoret, we have an anticoagulation clinic purely run by pharmacists. So that can still go to community practice as well. And many other, that's just the examples. Adherence. Then, of course, we are now talking of telehealth. We are told even surgeries can be done online, where another surgeon is somewhere else and somebody else is giving instructions and the surgery is done. So why can't we do that as pharmacists as well? We can have telehealth. I think somebody mentioned that we have started on that. Did he call it CL or something? I can't remember. I had that presentation yesterday by the chairman. Let's go to the next. So now, our customer is the patient. So we should have more focus going forward on patient outcomes. We talked of medication therapy management. I think Prof. Ndemo dwelt on that. There should be more of that at outpatient services mainly. Patient education, you can educate the patients because they trust you, they can communicate with you on dosages. You can also have adherence programs online where you have group practice with that. I'm happy you told me that there is a hospital as well that you run, so that whoever is a specialist can communicate with the pharmacist and the patient. The pharmacist can automatically remind the patient, the old patients, you have missed your dosage, etc., even through the phone, such services. The next one. So again, this is related to that appropriate use of technology in terms of health records. We are thinking of, having everything online. You're having a platform where you can have all the patient details. And then, I've mentioned about mobile apps, data analytics, trends, that can be part of research, etc. So it can be both for practice and also for research. You have huge data on the patients. Somebody in supply chain management was saying, we don't even know, sometimes you ask, in the next 3 years, how many antibiotics are you going to require? So we can still have that at local level. Next one. And then this is where we are not doing very well at all. In terms of manufacturing and retaining the factories that are still there. We heard this morning from Dr. Mwangi that we are closing down all of them. That's not good. That's not very good. But having said that, we really need to think of whether we are having group practice. We need to start manufacturing drugs here by our own. And I think it is capable. We talked about cosmetics, manufacturing IV fluids. I think we're already doing that. but we need to step up on that. And I think somebody mentioned, you talked of politics, and then the issue of, advocacy again, bringing down the taxation, etc., to enable that. So that is still required. That's part of the advocacy. Next one, please. Innovation. There are so many innovations I've had, but I picked on this. I just added this afternoon. I do a lot of research, okay, and do clinical trials, like I mentioned yesterday. But then, NGO world, how many pharmacists actually have their own NGOs? I was very impressed when you told me, because I'm still looking for a pharmacist who has an NGO. And there is huge funding in NGOs. People, you write proposals. There are so many things about drugs, about everything. Somebody will write a proposal of $5 million, $10 million easily. Do you know the kind of people who are doing that? Who are just diploma level. Then they will employ the Prof. So how many pharmacists? Once you have your own NGOs, you will employ a lot of pharmacists. So for the young people, that is, they cannot start, but they can join, they can be part of research. You can be, even if you are a research assistant, you can develop and, and really mature into even having your own NGO and attract huge funding. It's really huge. I know somebody who runs an NGO where he has more than $5 million. And she has employed a lot of professionals, all cadres. Now, let's go to the next one, please. Sorry if I've taken a lot of time. Now, so we need to have continuous, professional development, leadership. We have had a lot of that. Thank you very much. I didn't know that. We need to have a lot of collaboration, in terms of together we can achieve in the next, but I think our group, we wanted to work alone, but going forward, we have to have collaborative efforts. Next one. For the training institutions, first of all, and what I'm going to say is very controversial because we have not agreed, I don't know for how many years. Adopt the training for the training institutions to meet the market requirements. Now, you see, for the training institutions, we had a lot of issues like leadership. I don't see why a university cannot have like 6 weeks training to make people know, so I have also seen in other centers whereby a medical school will also train other BSc courses, related courses. I don't see why you should not do that. Some people fear that they will be pharmacists. They are not. You are doing BSc in technology, and they would know that they have done BSc in technology. They can do you can do a course in drug manufacturing or some aspects of drug manufacturing within the pharmacy school. You can do supply chain, even if it is a BSc course. Because I know we have said we want to add this to the pharm curriculum. But I think there is a danger of until it becomes relevant. We can train other cadres that are related, and either regulatory issues, and have people who are just trained on regulatory issues. So either as BSc or even postgraduate diploma for the pharmacists. So if I am a pharmacist and I want to join, I want to join the county and I want to do management, why would I not do that course? Why wouldn't Ruth come and train me for 6 weeks so that I become a leader from now that I'm leaderless to becoming a leader? Why? Quality management system, so that the pharmacist who have been trained can have something extra. I think our school should look at that. Now, in terms of the degrees, I know there has been a lot of emphasis on start of PharmD. I think we really should go back and look at, I know the argument has been, we will only have one degree, whether it's BPharm or PharmD or whatever. But I think over the years, the profession has really grown. Really, I think we should be thinking of having universities maybe, if we say maybe a university can train BSc in pharmacy, that doesn't make them pharmacists. If they want to be pharmacists, then they have to come back to pharmacy school. The beauty with that is that they would be controlled within pharmacy profession, other than having a situation where everybody who doesn't have a job becomes a medrep, so that he comes and teaches me pharmacology. And this guy done a BSc in economics. I get very tired. So I think we will benefit in that by expanding the training and also in terms of regulation, how we can, because we can regulate them within the profession, so that, because we already, like now, for example, in medical school in Eldoret, we are within the School of Medicine, we are training BSc psychology, BSc medical laboratory technology, BSc, the other two BScs, there is psychotherapy or physiotherapy. So that doesn't mean that because they trained in a medical school, they have become doctors. No, if they want to be doctors, they'll still come and start first year. So I think we need to also expand training. I think, I'm not sure if I'm qualified to say that, but that's just food for thought. Now, we also need more emphasis on training our people to be prepared for research. Because like I said, like NGO world, even research is a huge area for funding. I am been involved in research for a long time, and I know we have employed people, you know, the last 10 years or so, more than, who have had careers with very good salary, just for being research assistants, research managers, data managers, which we can still equip our pharmacists like on those short-term training. They can be research managers, they can be data managers, etc. Now, before I wind up, let's go. Do I still have anything else? Yeah, sorry, let's just go back. Now, there's something I want to emphasize. There is, you know, I have said that we have been laxed a bit and other people have come to join us. So we need to regain that. We need to think of how to do that, which I'm sure we are doing that. But for the young pharmacists, if we can have some form of clinical training, because now we are going to, you know, like I said yesterday, precision medicine, people have talked of genomics, that's the direction we're going. That's a huge area, because we tried that in Eldoret, we just did a short-term training for 1 year for pharmacists, and they practice 100% clinical. So even if we don't like PharmD, we can still train, have ways. By the way, we, like in Eldoret, we have a curriculum for PharmD. PharmD and BPharm are exactly the same thing. It's just the emphasis. Which emphasis? Is it more of science or more to clinical? So that one really would, people, if people can understand and we have enough advocacy, all hospitals will have clinical pharmacy involved in all clinical departments, and we will still require probably another 5,000 pharmacists. Thank you very much.
There you have it. There you have it. I think he's given us food for thought, where to go in terms of training, practice, advocacy. You know, advocacy. Who trains people on advocacy? Lobbying. you know, I worked for a multinational for 24 years, and it was then the world #1 vaccine company. And many of the new vaccines that were coming that needed to be included in the vaccination programs, we had full-time employees based in New York, as just to do lobby. And I realized that to do lobby, you need a skill set. You need a certain skill set. Now, partly, maybe we have lost a few battles, important battles, because probably we didn't have the right skill set. And because of this encroachment by different players, probably that could also be a course that can be offered for us to come back and earn a certificate or a diploma. Because we are losing out on the legislative areas. And today, I think when you look ahead, there may be chaos where companies registered vet medicine, and now the whole thing is moving away. How is that going to unfold? I know there is legislation going on and the PSK is working, but probably with better skill set, maybe we could retain. I'm just adding a voice, and now we are at the tail end of our program for the day.